Of every 20 premature babies born, one is Nigerian. The country accounts for over 870,000 preterm births, the third highest in the world. This alarming trend is spurring healthcare authorities to pay more attention to neonatal needs. CCTV's Kelechi Emekalam takes a look at some of the initiatives in Nigeria.
The neonatal ward at Kelechi Hospital looks like this all year round, full of babies too weak to survive on their own. Many stay here for weeks, where machines help them breathe and regulate their body temperature. Hundreds of thousands of babies across Nigeria are born premature for several reasons.
Antenatal care is not readily available to our mothers, either as a result of ignorance, negligence, or even having enough of it. And because of that, many of them, they tend to have premature babies as a result of a lot of complications, some of them young mothers, some hypertension in pregnancy, and all that. Then also with the event of in vitro fertilization, most especially in urban areas, we'll find out that we'll have a high level of turnout of preterm babies from this.
Babies born too early aren't properly developed and are at higher risk of dying than those who remain in the womb for the full term of pregnancy. Premature babies who do survive may have lifelong disabilities, including learning, visual and hearing problems. The World Health Organization estimates 15 million babies are born prematurely every year. African countries account for 8 of the top 10 nations with high preterm birth rates. In Nigeria, premature births are often due to a lack of healthcare services and awareness of the risks.
There are many of these primary health centers. You have just very few people that can offer such services, and you have a load of women coming. In fact, part of the reasons why some women don't go there is that when they go, they stay almost throughout the whole day and they get discouraged. So training of traditional birth attendants, training of traditional birth attendants, and training of nurses generally and midwives is very important.
Healthcare authorities in Nigeria are now pushing for more widespread antenatal care services, as well as other care and support for mothers before, during and after childbirth. Kelechi Emekalam, CCTV Abuja, Nigeria.
Well, to discuss the issue of preterm births in Africa a little further, we're now joined in studio by Dr. Jane Mashira, a gynecologist at the Kenyatta National Hospital. Dr. Mashira, thank you so much for your time this evening. Now, of course, the report we were just looking at was really looking at the Nigerian context, in which it states that of every 20 premature babies born, one is Nigerian. Is this an overall African trend? I mean, how does this compare to a country like Kenya, for instance?
Yes, thank you, Lindy. This is an overall African outlook, because in Kenya we also have quite a number of premature babies born. Out of every 8 births to 10 births, we have one who is premature. So that gives us almost the same statistic.
As Nigeria.
Yeah, as Nigeria.
And what would you say are the key dangers associated with premature births?
Now, premature babies are born without the necessary, their organs, especially the vital organs, have not matured enough. So one of the biggest problems is problems with breathing. So one of the key things that must be done is, of course, assisting them to breathe. And there's an initiative called Assisting Babies Breathing that is done by WHO. The other problem is temperature regulation. This baby's skin is very thin, and so they're not able to regulate their temperature, and they tend to get low temperatures, what you call hypothermia. Other problems include glucose problems and bleeding issues. Yes.
And when you look at the high statistics that you mentioned for countries like Nigeria as well as Kenya, what are health systems missing in Africa in as far as providing medical assistance to mothers of preterm babies?
Because of the problem we've talked about of temperature regulation, then these babies must be assisted with warmth, and also with a breathing problem, then they need to be assisted with breathing. So incubators and also what we call neonatal ICU care is very necessary. And with the challenges we have with our health systems, those numbers are not enough. So you'd find out of maybe only about 10% of babies will get that necessary care. So that is key in taking care of babies.
And when you look at those high numbers once more, is there a responsibility on expectant mothers? I mean, why is the rate so high in Africa? Is it something that mothers themselves should be keeping track of throughout their pregnancies?
No, usually not something that the mothers have done, but of course seeking early care in antenatal care is important so that all those risk factors are identified. And then remember that in Africa especially, we have very young mothers. We also have malnutrition or malnourished mothers with low weight. So that is one of the risk factors. We also have things like malaria. We have anemia, which are very high in our populations. So those are the risk factors among many others that are coming up, like hypertension in pregnancy and diabetes. That makes us as doctors want to deliver these babies earlier for their own health. So, of course, key is in early seeking care early during pregnancy, so that all these risk factors can be identified.
Indeed.
Yeah.
Now, you've mentioned some of the dangers that apply to the child once born, you know, before term. What are some of the dangers now, if you can just go into the specifics that some of the mothers may face? As you mentioned, some, you know, young women are getting pregnant. What happens if a young woman then gives birth prematurely?
One of the problems is that when with the younger mothers, they also don't have very good insight on health-seeking behavior. So they might not know that they need to go to hospital, that these babies need extra care. So they are likely to deliver and not go to hospital, or maybe go to a hospital that is not well staffed with the necessary care. The other thing is a big problem with these babies is infection, infection control. So with the younger mothers also, we may not have that kind of insight on good infection control prevention. So it is important for the healthcare system then to absorb these mothers and take care of them. The other issue, of course, is nutrition for these babies. Most of them are born without good suckling reflexes. Babies who are born at term, of course, are ready to feed, but very young babies might not be able to feed very well. So if then the breast milk is not ready, or they're not able to feed frequently enough, then that's another risk factor. So it's especially worse for younger mothers.
Indeed. We'll have to leave it there, but thank you very much for that very informative insight into premature births in Africa. Thanks to Dr. Mashira, live with us here in studio.